Hi, welcome to Checking In with Amy. My name is Amy Goldberg, and I'm a registered nurse for Neighborhood PACE. Neighborhood PACE stands for Program of All-Inclusive Care for the Elderly, that being 55 years of age and older. Our catchment area is East Boston, Chelsea, Revere, Winthrop, and Everett, and also including Malden, Medford, Melrose, Stoneham, and Boston's North End. The goal of the program is to keep people living safely, independently, and healthy in their own home. Today, we're actually filming from the Jack Satter House in Revere, and we have an audience. So this is our first time really on the road. My guest today is Chad Williams, who is an occupational therapist who's actually been on my show before. So Chad, welcome.
Thank you, Amy.
Thank you for coming. So, Chad, tell me a little bit about what you do for Neighborhood PACE.
Sure, Amy. So I'm an occupational therapist, and I oversee the rehab department for the PACE program for Neighborhood PACE. And in that role, we see a lot of things, a lot of people who have falls, who need safety in the home. And like you mentioned, our goal is to keep people safe in their homes as long as they wish to stay there.
Right. So the topic today is why falls happen and what to do about them.
Right.
So let's talk about what's a fall. Let's just discuss that first.
Okay, well, it seems self-explanatory, but the government has taken upon themselves to define falls. And the quote I have here is from the Centers for Medicaid and Medicare Services. And it says, a fall is unintentionally coming to rest on the ground, floor, or other, lower level, but not as a result of an overwhelming external force. So, in a wordy way, it's saying that you go from a higher point to a lower point, and no one pushed you.
Okay. All of which isn't great.
No, not at all.
So, why are falls so important as you get older?
Okay, well, I have some statistics, and that can illustrate why this is important. So, 1 out of every 5 falls results in a serious injury, typically a fracture. Typically, too, with fractures, it's the hip or the humerus, the upper arm, is what we typically see. 800,000 people are hospitalized every year as a direct result of falls.
Wow.
95% of hip fractures are caused by falls. And one of the most telling things is medical costs are in the news all the time with the healthcare acts and such. And the number I have here, $31 billion of direct medical costs are linked to falls on an annual basis. And this will only get more and more over time as we progress, just because more and more people are aging every day.
Right. That's a huge amount of money and statistics. And so what I want to discuss next, and we'll go over them generally, and then we'll touch on each one separately.
Sure.
So the main causes of falls would be what?
Okay, so falls it's not just about tripping on something and falling down. There's a lot of different things that factor into a fall. I have a list of 7 here. It's weakness, muscle weakness, medication use, vision issues, not wearing the proper footwear, something called orthostatic hypotension. You're a nurse, you know what it is, but we'll talk about that. Decreased sensation in the feet, and something else called mechanical falls, which is just tripping over something in your way.
Okay. That's a lot of reasons.
Yeah, there's a lot of reasons. There are a lot of things going on with falls, not just one single thing.
So let's take them one at a time. So first is weakness and decreased flexibility and difficulties with walking.
Right. So in order for me to walk, I need to have good muscle strength. Not just in my legs and my thighs, the hips. I also need good muscle strength in what they call your core, your abdominals, your low back. So if I'm having weakness in those muscles and I need to step over something, I may not be able to clear my foot and end up tripping.
Right.
So that can be a problem. And also I talk about flexibility. So flexibility where muscles can't give. So the analogy I always use, Amy, is you have a junk drawer at home.
Yes.
Right.
I got more than one, actually.
Yeah, me too. So in that junk drawer, you likely have some rubber bands in there. Let's say you go in and you reach for a rubber band. I need to use. If you ever pull out one of those rubber bands, it's old. It's frayed as you pull it apart, and it rips apart.
Yes.
So if you think about a muscle that's not flexible, and it gets pulled apart, it can't give like a fresh rubber band can. That inflexible muscle might tear, and that can cause some issues too. That could result in a fall. If you lose your balance just slightly and you don't have the strength to recover in time, you could fall as well. So not having that strength, not having that flexibility can be detrimental. I mean, it can cause a lot of issues with falls.
Right. That's a good example, the rubber band.
Yeah, I like
picture
using
it.
that one because everyone has a junk drawer. People usually have rubber bands in there, so it's relatable.
I know. The next one that we talked about, you and I, are medications. So how can medications impact people and cause them to fall?
Well, there's been a number of studies done on medications. A lot of the studies point to the fact that those medications that cause you to be a little woozy or they can make you be drowsy, things like that, can cause falls. Because if you think about it, if you're feeling dizzy or a little, for lack of a better term, out of it a little bit, you may not be able to react to things as quickly.
Right.
You may be more clumsy, right? So those factors can relate to you having a fall. So again, it's usually those medications that cause some sort of change in how awake you are or alert you are is typically what happens there. So what we recommend to folks is, at least on a yearly basis, they're usually meeting with their primary care doctor. So it's a good time for people to look at their medications to understand what they're on and see, hey, do I need to be taking all these medications? Could any of them factor into a fall? Or the other thing is, let's say you're put on a medication and you're feeling a little lightheaded, a little dizzy, things like that. Well, check in with your doctor. You need to be proactive. You need to call and find out what's going on. Maybe this medication is not the right one for you. Maybe you need a lesser dose or whatnot. So medications are a big deal for folks, and as it relates to falls.
And at Neighborhood PACE, we have our own pharmacist. So the medications are very carefully watched and make sure that they interact well with each other, which is really an important point. Vision issues. So if you don't see right, or tell me what happens as we get older in regard to the vision and falls.
Yes, so vision over time. So just something to chew on a little bit is, so a 20-year-old, when you relate a 20-year-old to a 60-year-old, the 60-year-old needs 3 times the amount of light in order to do a task. So if I were writing or reading, I should actually have 3 times the amount of light as a 60-year-old compared to a 20-year-old.
Right.
So some of the reasons for that is, in your eye you have the lens, and when the light comes in, that 20-year-old, the lens is clearer. So that light focuses where it needs to focus, and I can see better.
Right.
Now, over time, the lens gets cloudier as I age, and that what can result is the light gets a little bit scattered. Doesn't hit the back of the eye and focus appropriately, so it makes things a little fuzzier. So with that in mind, though, I'm not recommending that people just go out and start buying, they had a 40-watt bulb, now they need a 120-watt bulb, something like that. Because at the same time, you increase the light, you also can increase glare. And glare for folks with vision issues is a big deal. Right. Because if you have a lot of light coming in, it makes it hard to see where you're walking and things like that. Might be more prone to tripping and other things. Now, the other important aspect of vision to think about is when you go from a low light situation to a very bright situation. So you've been to the movies, I assume, right? And after that movie, maybe it's been dark for a while. Right. If you sometimes walk out that exit door right in the theater, all of a sudden it's a bright day, it's really sunny. It takes a while for your eyes to get used to that light. And at that point too, you're also at risk of not seeing things appropriately, and maybe you might trip or something like that. So you have to be really careful about how you do your lighting as you age. You need enough brightness, but you also need to balance it with reducing glare. And that's something that we can certainly help folks with.
And just as a point of interest, when people join Neighborhood PACE, we do a home safety evaluation.
Right.
And check out all these things, like are there any tripping hazards and the lighting and so forth, so that people are aware
Yes.
that we're helping them and looking for any issues that we can take care of prior to their enrollment.
That's right. We want to make sure people are safe in their homes.
Right.
So in order to do that, we have to see the home environment.
Exactly.
And lighting is one of those aspects, as well as things clutter.
Right.
We all have clutter here and there. So it's just eliminating tripping hazards and things like that too.
Right. The next one is, which we've talked about, improper footwear. So I like to wear many times high heels or flip-flops, and you've talked to me about this.
Yeah, we like to have a good laugh about this.
Yes.
Because both of those types of footwear have been researched as being far more, I don't want to say dangerous, but they can relate to falls a lot more than a sturdy sneaker might.
Right.
So you need support. You need a nice firm sole. If you think about it, if you're in high heels, you have that one little, I mean, I've never walked in high heels, I have to say, but I imagine walking on high heels is difficult.
Right.
Right? So it relates to balance. And flip-flops too, they don't have a lot of support.
Right.
It's summertime. I like to go out with flip-flops as much as I possibly can. That being said, you need to be careful.
Right.
The other thing we need to look at is if you are at home, you're wearing your slippers, they shouldn't be those really puffy, like maybe this much memory foam kind of slippers. They're not that firm a support, and they can relate to falls as well. So we just need to be really careful. We have a sturdy sole, good support. Not saying you can't wear slippers, but maybe if you wear slippers, it's the ones with a firm sole.
Okay.
So in all the studies that have been done, it's usually flip-flops, high heels, those sorts of shoes that relate to falls
I know.
and fall risk.
I know.
Sorry.
So, I know. I can't look the way I want. So another one, which sounded like a very big technical thing, is called orthostatic hypotension. So let's talk about that.
So orthostatic hypotension, all that says is when I go from a lying position to a sitting position, or a sitting position to a standing position, my blood pressure drops. Now, what happens when the blood pressure drops is you can get lightheaded, you can get dizzy, some people can get nauseous, but some people faint. So let's say you're laying down in bed, or you're even sitting and you're prone to this. The phone rings across the way. I got to get up and get to that phone, right? Let's say I'm sitting in a chair. Phone rings. I stand up quickly. I have this condition, and I lose consciousness. I fall. So what could you do there? Well, one of the things we recommend is that you take a 10 count before you move. So if I'm laying down, I come up to sit, I'm going to count to 10 before I go anywhere else. Or if I'm sitting and I stand, I'm going to count to 10 and let my blood pressure rise back up so I don't have that drop that could result in me fainting or falling. The other thing you can do is bring things close to you, right? Like if you have a phone nearby, keep it right by you.
Right.
And probably no phone calls that emergent that you have to run over to get it. Most of them are telemarketers nowadays,
Right.
so there's no need to put yourself at risk.
That 10-second rule is wonderful. And I think if everyone does that,
Yes.
it's not a lot to ask. Because nowadays in our life, everybody's rushing. They're,
True.
got to get up, got to get at it. And just to be able to take that 10-second interval. And also, many times doctors do check your blood pressure sitting, and then they take it standing, and you wonder why they're doing that.
True,
Would be
yes.
one of those reasons
Yes.
to look for that.
Exactly. And I think the 10 count is just a good way to approach life.
Right.
Like you said, everyone's rushing around.
I know.
If you can count to 10 before you get moving or before you react to something, it's just a better way to approach things anyway, in my opinion.
Mine too. So the next thing, we're almost ending it, we got just this one and another one, is decreased sensation in your feet. So what's causing that?
Typically, this is related to folks who have diabetes, and they have something called peripheral neuropathy. And all that means is you have decreased sensation, and typically in your extremities, and especially your feet. So what happens, if you think about it, if you don't have feeling in the bottom of your feet when you're stepping, you really have to be aware of where your feet are in space. So it's almost like learning to walk again in a way, because you need to know where your feet are when you're walking, in case there is let's say you're walking outside the sidewalk, there's the sidewalks that don't line up quite right? You could trip over that. You have to be really careful and watch where your feet are. So if you start having a lot of falls, maybe that's what's going on. Especially if you have diabetes, maybe it's something to get checked out. Perhaps you're starting to lose that sensation in your feet, and that could be a big thing, and it could be relating to why you're tripping or falling, or maybe feeling off balance. So it's worth your while as the person to go talk to your doctor and find out if there's something going on.
Right. I think it's all such good advice, and I hope people who are listening really follow along with this.
Right.
So then finally, the last reason that you mentioned was mechanical, which is like tripping over things.
Right. So mechanical falls could be tripping over things, your cat, whatever it is, on the floor, let's say. You're walking, you trip. Oftentimes you see mechanical falls as a reason for a fall in an emergency room visit. Right. And I was looking at a study, I read a study on this. The people who conducted the study, their opinion was, if you have a mechanical fall as your diagnosis, you really need to press more to find out what's going on, because there's likely something else in the background that related to that fall. Now maybe not, maybe legitimately your dog or cat ran out in front of you. So in that case, there's probably nothing you could do, right? But maybe you changed medications in the past week. Maybe you developed orthostatic hypotension for whatever reason. Maybe you were wearing your flip-flops. I don't know. But don't take mechanical as the sole reason that you fell. So press for more information, maybe not at the emergency department, but definitely with your own doctor. You could talk to the doctor, explain the situation. I fell. I just want to make sure there's nothing else in the background going on that I need to be aware of. All these things we talk about, it's about being proactive.
Right.
Not waiting for a problem to happen, but actually addressing the problem before it occurs. So that's what mechanical is, and that's my soapbox moment on mechanical falls.
So I want to thank you very much for being my guest again.
Yes, thank you.
I love having you back. And the good thing with the Neighborhood PACE is all of these things that we discussed, we take into consideration. We make sure that people stay safe. And we have a fall committee, I believe.
We do, which I chair that.
Yes, to make sure that all the falls are really looked at very carefully. And so thank you again.
Oh, thank you, I appreciate it.
And if you're interested in more information about Neighborhood PACE, please feel free to call us at 617-568-6377. And again, thank you for tuning in, and I look forward to seeing you again soon. Be well.